Hello, I'm Virginia Miller. I'm Professor of Surgery and Physiology at Mayo Clinic and Director of the Women's Health Research Center. The title of the article we will be discussing today is 21st Century Women's Health, Refining with Precision. The question is often asked, why do we need to categorize medical treatment or medical care in terms of men's health or women's health? Well, the answer is simple. It's all about the patient, providing the best care for the patient. But in order to do that, we must understand the basic differences between men and women. There are two variables which all humans share, sex and gender. Well, what do we mean by these terms? Sex is a biological variable. Sex is defined by the presence of the sex chromosomes, two X for a woman and an X and a Y for a man. Sex is biological. Gender, on the other hand, is a social construct. That is, how the individual interacts with their environment and society, and how society interacts with the individual. Unlike sex, which is the biological variable, gender is more fluid and exists on a continuum. So when we consider precision medicine or evidence-based medicine, we have to account for these two variables. Over the last 20 or 30 years, women's health has been defined by reproductive rights. It's been politicized. But we need to depoliticize women's health. We need to understand how these variables affect a woman's health. Typically, research to provide us the evidence by which medicine is based has been conducted on male animals. The concepts derived from that research have been tested in clinical trials conducted mostly on men. Yet the results of these trials have been applied to both men and women. Therefore, medical care is biased towards what might be optimal to care for a man. This needs to change. Now there is more research being conducted on female animals. There are more women in clinical trials, and we need to continue to analyze data from clinical trials based on sex. But research is not enough. We need to take this evidence and educate the future care providers. In this article, Dr. Marjorie Jenkins and I have provided some new concepts on how to incorporate concepts of sex and gender into medical education. Using the translational research science paradigm of T1 to T5, we apply these concepts to education beginning at the most basic level in medical school. These concepts need to be continued to be emphasized and implemented throughout the medical training into fellowships, residency, and specialty training. Then these concepts can be applied by the healthcare provider in any setting that they may find themselves, whether that is nursing or pharmacy, family medicine, or specialty care. So the overall goal is precision medicine, but we can't achieve that goal without considering these two variables which all humans share, sex and gender. So in order to achieve these goals, we need to apply these principles of evidence-based medicine from research into education and then to clinical practice. That will be precision medicine. Our commentary provides innovative concepts and guidance for researchers, educators, and clinical providers so they can achieve women's health through a sex and gender lens. Thank you.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.